Right now, because I'm still trying to keep a very open mind, this is actually my second core rotation here at CAMC. I definitely have an interest in surgery. My other interests include GI and cardiology as well. So we'll see where the road takes me.
They're involved in all aspects of patient care, including outpatient office, surgery, as well as inpatients.
I think it's crucial that students get the experience that I'm getting right now here at CAMC. The first 2 years in our medical training, we're spending it in a classroom. And so all the pathologies that we see is just in a textbook. But coming into the hospital and seeing actual patients who have these pathologies that we learned about, it really gets your mind thinking in a different direction that you normally wouldn't be thinking in a classroom setting.
The training is important. The students get an actual patient experience, meaning that they're not only learning in books anymore, but they're able to apply the knowledge that they obtain in books with actual patients. The nice part with the general surgery rotation in itself, even if the students do not want to pursue a career in general surgery or any type of surgical specialty, it gives them access to see how these surgeries actually are performed, as well as when they would need to consult a surgeon.
We might have learned about certain symptoms that may typically be present in a patient on a textbook, but seeing it in person, we see the variety of those symptoms and just how they're presented to us in real life. It's two completely different things. And so I've really learned to see how important it is to take a step back and look at the big picture first, instead of being so focused on a specific subject, which is what we tend to be like in a classroom scenario.
The students themselves teach me a lot. They always keep me on my toes, bringing in new differential diagnoses that I may not have considered at first, and at the same time keeping me up to date in the latest research as they bring in ideas that they have read through research articles that I may not have looked over yet.
I think the most important thing that I've learned, especially out of this rotation, is that if we see a patient, we figure out what's wrong with them, we treat them, they're not done yet. There's a whole life to that patient outside of them being in the hospital. And what I learned, especially during my surgery rotation, is that just because we've treated a patient, we might have taken out a gallbladder, we still need to take into account their life outside of the hospital. For example, how are they going to get their medications? Do they have the means to come for the follow-up appointments? I've really learned the importance of taking a holistic approach when it comes to treating these patients, both inside and outside of a hospital setting.